Hello dear doctors and students. In this lockdown, we are taking its benefit by learning and upgrading our knowledge by arranging such live lectures. Hope everyone enjoy my live lectures on pain management. The successful treatment of digestive disease, which is mainly includes gastritis, peptic ulcer, colitis, IBS, hemorrhoids, fissures, hepatitis, cholecystitis, cirrhosis of liver, and various cancers poses a challenge to the entire medical fraternity, not only homeopathy. Homeopathy has a significant role to play in treating these disorders, not always curative, but as long as symptoms exist. All of us know when the symptoms exist, homeopathy treats. This does not mean that the presence of symptoms, all the disorders are treatable, but the underlying pathology always needs to be considered. In advanced pathology, homeopathy can play a palliative role only. It is very essential for physician to identify the exact role of the science in treating a particular disorder. We should approach the case in a scientific manner. If we follow our principle, then success is the only thing we get to deserve. It is not possible to cover each and every topic of gastrointestinal tract. I will try to cover maximum disease which come across in our routine practice. Start giving result in a few acute conditions and make yourself master in that, then start treating deep pathology. If you want to learn each and every case and its management, you can refer my book, The ABC of Digestive Disorder. So today, my dear friends, we start acidity or acid peptic disorders, known as a GERD also. Now the Argentum nitricum, one of the most important and popular polycrest remedy for the serving gastralgia attended with heartburn which is aggravated or excited by eating. There is a loud irritation which could be heard to surrounding people and even sometimes to the next door neighbor also. So patient जब आते हैं तब बताते हैं कि सब इतनी आवाज़ से डकार आते हैं, पूरा फैमिली सुन रहा है और नेबर भी सुन रहे हैं. And that look in a repertory, the stomach irritation loud, argentum is the 3 mark. No doubt the asafoetida and the platina is also there. So gnawing pain seated at one spot or radiating to the different parts. Hard pressure in the pit of the stomach brings relief. Abdomen all the time distended with a nausea and increased thirst. You all know that desire sweets is there, but stomach complaints aggravated after eating sweets also there. So in a repertory we can see the stomach indigestion, argentum is there. Now we discuss about carbovage. Generally, I use this remedy for those who suffer from fermentive dyspepsia with acidity and gastralgia with a water brush. Especially aggravated at 3 p.m. Patient आके पता है मुंह में पानी आता है बहुत. So irritation type of water brush, carbovage is a 3 mark in repertory. It has also thirst for cold water and bloating of the stomach and burning pains relieved by irritations. Sour food aggravates. Then come Robinia. I prescribe Robinia when there is an excessive acidity of the stomach and there is a nausea and vomiting of the intensely acrid fluid and there are frequent sour irritation. Particularly when the patient says कि रात को बहुत एसिडिटी होती है सर, रात को मुझे उठना पड़ता है, जेल्यूसिल लेना पड़ता है. So give Robinia, always helps. Then iris versicolor. Mainly I am giving the remedy this when there is a great burning in the whole GI tract. Patient बताएगा पूरा GI tract में जलन हो रहा है सर, खट्टे डकार आ रहा है, nausea, vomiting हो रहा है और vomiting बहुत ही खट्टी है जैसे vinegar जैसी है. So we will look in the repertory, the acidity vinegar like only iris is given. No doubt it is a 1 mark, but only one remedy is there. And other differentiating point with the Robinia is that both have a sour irritation and vomiting. So here the Irish patient complaining about the headache also, which begin with a blur vision. So gastric headache iris is a 3 mark. जो गैस ऊपर चला जाता है, सर पे चला जाता है. Then comes oxalic acid. Now this is a medicine that is not frequently used by many homeopaths, but it gives a good result in patients who are emotionally disturbed with headache, fatigue and irritability. Pain is not continuous and are worse from motion, and while thinking about always aggravates. The gastralgia generally appears after eating and heartburns during pregnancy. Then natrum phos, one of the most popular biochemical remedy, and it is known as the acid neutralizer for stomach. I use this remedy in a 6x potency. Whenever any constitutional prescription is there, I always give along with that natrum phos 6x. It gives a good result and fast result. The stomach disorder by fat and milk. There is an emptiness, fullness, irritation aggravated after 2 hours of eating, and extreme thirst and sour body or sour odor of the body. Now we will discuss about aphthous ulcers. Aetheusa synapium is one of the remedy usually given when aphthous in the mouth and throat, tongues as well as in tongue. Sensation of pungent heat in the mouth and throat with a great difficulty in swallowing. That is the stinging in the throat between the act of deglutinations. We give in a lower potency, 30. Now another remedy, borax, very popular remedy. Mostly all homeopaths use this medicine for aphthous. Usually we give in infants, children as well as in old people having aphthous in the mouth and the inner surface of the cheeks with salivation. There is a great heat and dryness of the mouth. Pain, especially when chewing. Patient बोलता है खाना नहीं खा सकता हूँ मैं, इतना जलन हो रहा है, इतना दर्द हो रहा है. So look in the repertory, stomach aphthous, borax is the 3 marks. Then it's very painful also, the borax. We give generally 30 or 200 potency. Then come Merxol, very common again remedy, but ulcerated gums, tongue and cheeks accompanying with a profuse salivation. Most important, salivation, and as soon as you see the mouth or ulcers in the mouth, the fetid breath comes up, and that you can also see or you can also feel, and the burning pain aggravated at night. So aphthous accompanied by salivation, Merxol is a remedy. Nitric acid, fetid and acrid saliva which causes sores on lips, chin and cheeks. Yellow teeth and loose teeth. Ulceration of the tongue with tough ropey mucus. As such, we know that nitric acid is one of the syphilitic remedy and very good for ulcer. So we give when the constitutional prescription may be 200 or 1 m, but in an acute condition we give 30 potency. Sulfuric acid, aphthous mouth and gums, yellowish and painful, talking difficult for them. They cannot talk because of pain. Great weakness, ecchymosis. So here we had a talk about acidity and aphthous. Now in my next video, you will learn constipations as well as diarrhea and dysentery. Thank you.